Gentlemen, you are both drunk on cosmic wine.
Welcome to the show. I'm Dr. Mark Sylvester.
And I'm Dr. Richard Schulman. This is Alt Psych.
God, that's bone jarring.
Yes, it is.
Welcome to the show. I'm your co-host, Dr. Richard Schulman, also known as David Gilmore.
Well, I always wondered what a guest host was. Is that like Jumbo Shrimp or something?
That's Ed McMahon.
Yeah.
I'm trying to remember the name of Conan's, or not Conan. Yeah, Conan's sidekick.
Andy something.
Andy Richter. Thank you.
There you go. There you go. I don't watch these things anymore. I don't know. I still remember Johnny Carson. Shows you how old I am.
Who?
I'm about 3 hosts behind, you know.
Well, Johnny would never talk about something as awesome as Immunopsychiatry Part D.
Only you would. Very few people talk about cool stuff like this. Well, maybe a few.
I think it's cool because it works and it helps. And, you know, we did promise a couple cases. I suppose we can get to those today, but just kind of a quick recap of the part one was, hey, this concept that inflammation and autoimmuneness affects the way you think and feel.
Let's not get ahead of ourselves.
Gosh.
We have a mental wealth tip first.
We didn't rehearse that. I apologize.
We don't really rehearse much of anything because we're very spontaneous, you know, we're sort of improvisational kind of thing. All right, this is a good one.
Me up.
This is a good one. Now, some people know this already, for those of you who don't know it. Never confuse kindness with weakness. That's number one. And the second one is don't underestimate small kindnesses. They may mean more than you think. And that's the mental wealth tip for today.
That's excellent.
I like it, yeah.
Because
I have my lightning hat on because 7th game tonight. So, you know, we're going to be heading on out to Tampa to yell for our beloved Bolts.
Go Bolts.
Go Bolts. So I'm all ready. I'm set. I even have a shirt. You know,
that's baseball, right?
No, it's crazy Russians and Canadians hitting each other with sticks.
I'm not gonna lie. It's oddly alluring watching grown men act like tantrum children and beat each other with hockey sticks.
No, that's Congress you're talking about now.
Yeah. I thought that's what we were talking about.
Congress of baboons. You know, that's the thing. No, it's really fun. I love going, especially when we win. It's more fun when we win.
Yeah, it's not whether you win or lose.
Great that we segue from kindness to hockey to you know, like inflammation. I think it's a continuum, you know, to inflammation.
Be kind and enjoy other people knocking their teeth in.
Hey, that's what dentists are for.
But you know what happens when you get your teeth knocked in? You can get inflammation. And you know what inflammation can do in the old noodle in the body. So I don't know.
Make your eyes really wide.
We were talking about all the different approaches, right? To immunopsychiatry, not just the concept, but some concrete examples of you know, pro-inflammatory cytokines and circulating autoantibodies, and you know, something that I think is a lot underappreciated is encephalitis, which basically means inflammation of the brain, but it turns out the brain is exquisitely sensitive to inflammation. And it interrupts its functioning if you have an inkling of a clue how the brain works. It's absolutely remarkable that the thing works as well as it does under the conditions, the demands, the environment, the set of tasks and computation. It absolutely is a miracle that I can walk and talk and have voluntary control over my bowels most of the time. But inflammation undermines that, whether that's from a virus, which is going around, I heard, whether that's from a substance like smoking cigarettes, or everyone's into the medical marijuana. Smoking is very pro-inflammatory, very pro-inflammatory. And by the way, we're just talking about the brain. We're not talking about all of the effects inflammation has on the rest of the body. which can lead to cancers and all kinds of other awful things. But let's focus on the brain and behavior, because we gave a number of examples, like we talked about hepatitis C treatment and interferon, and it being a potent inducer of the inflammatory cytokines, and IL-6, which is an interleukin, which is kind of a first responder. Tying that, even studies where they reproduce, like that typhoid vaccine we mentioned, that not only reduced cognitive and performance and people's, brain fog, but it led to depression. And it was directly related to these circulating IL-6. And I think what we say everyone can relate to, because everybody's been sick and they felt brain fog while they're sick, and they felt down and depressed while they're sick, and they felt unusually good as they got well. So why is it that we don't approach the body this way? To me, as an engineer, it's puzzling.
That's what your advantage is, being an engineer. I was just reflecting on the stuff that we talked about last week, and when I rewatched the podcast, I was just...
Oh, you were the viewer.
I was the viewer, just in case. I actually seriously thought what the stuff that you came up with was just fantastic, and the stuff that you're doing, makes so much sense to me. And I hope that people will really think about the elegant simplicity of this model. That if you have inflammation, your body's not going to work right, your mind is not going to work right, and maybe it isn't what we thought. Maybe it's a lot simpler.
I enjoyed it too, and you're not the only one. YouTube has their little metrics, and I will say, you said we did 58 shows so far, something like that. Out of all the shows we've done, last week's had the fastest, most amount of views. It's some like metric.
Well, I really, it feels a little crazy. Not that, but the idea that this would be the last resort rather than the first thing, considering there's really no side effects to speak of from the stuff that you do with people, and the potential. If you look at the risk versus reward ratio, the risk is almost nothing. And
no, but it's an excellent point. That usually by the time people see me, they have literally tried everything, and then I'm talking about, well, hey, let's do something simple and obvious.
Yeah,
and they're shocked when it works.
And it will work. My belief is it'll work on most people if they are persistent with it.
We have 3 people in the infusion room right now, all getting well. So it's been eye-opening. And one of the things we talked about during the last year and a half is people rethinking, reanalyzing how they conceptualize health and wellness and illness, for that matter. Specifically, we're talking about schizophrenia, I think, and the serum antibodies against dietary antigens and something called gliadin and casein and things like that.
Well, you were talking about how 90% of schizophrenics smoke cigarettes because of the, what they're bringing into their bodies. And I worked in patient psych, and that's 100% right.
And it's very peculiar. I mean, it didn't stick out as much in the 50s and 60s when kind of a lot of Americans were smoking, but America, one of our great achievements, I think, is we have much lower levels of tobacco smoking. I mean, a lot of these people went to vaping, which I don't even know how to correlate that with inflammation. And they're seeing a lot of lung diseases and stuff coming from the chemicals that because I guess China is the bulk, if not the sole manufacturer of the fluid for the nicotine vape fluid. But tobacco use is actually relatively low as opposed to European countries. When I lived in Spain, I was shocked how many Europeans smoked still, because they're a first world country. They're not dummies. These aren't children. This is a first world country like the United States. Well, they have higher smoking levels.
Well, they're not eating GMO food over there for the most part either.
No, but they're hanging people in their jails, I hear. Don't go there. I actually know right where that jail is.
You can't really make an Epstein joke on that. Like, dear Mr. Cotter, Epstein didn't hang
Oh,
himself.
great. Now you just got us blacklisted, man. Had to say the name.
Hey, they don't like Welcome Back, Cotter. That's their problem, you know.
Oh, okay. I like that.
You know, it was a great show, man.
You know where we ended? It just occurred to me. We were talking about the NMDA receptor because for psychiatrists, that's not been a target that we knew anything about until really the beginning really was the 90s. And I had done some research on it. And then in the last 10, 15 years, when you're starting to see new medication targets for the NMDA receptor, which by the way is it's a glutamatergic system, meaning glutamine is the neurotransmitter, unlike serotonin or dopamine or norepinephrine. It is by far the workhorse in the brain. 70% of all of our cells that communicate electrochemically use glutamate as a neurotransmitter. So it is the proverbial brake or gas pedal. Sorry, GABA would be the brake pedal. It's the gas pedal. And so we know people who have autoantibodies to the NMDA receptor, sometimes a voltage gated calcium channel, which is coupled along with this, it causes psychosis.
Okay, so can you like dumb it down for dummies like me? What does that mean?
We are figuring out certain regions of the brain when they're inflamed, what it causes, whether that's depression or psychosis or delirium. We talked about little old ladies can get a mild UTI and be beyond Thunderdome very quickly. They can get into, seeing little purple people or bunnies running in the room or, walking into walls. It can be profoundly altered in a very short time from pretty much a mild inflammatory insult because your cognitive reserve is less when you're 80 as opposed to 20. So we extrapolate that to a 20-year-old. They're not immune to infections. They're not immune to inflammations or even autoimmune periods or processes because the body will eventually attack itself to some degree, depending on what the insult is. If it's a serious autoimmune illness, you get kind of irreversible or what's thought to be more irreversible autoantibodies. Like that's what diabetes type 1 is, the childhood diabetes. It's these autoantibodies to these pancreatic islet cells, and it wipes them out very quickly, and you have no more for the rest of your life. This is completely reversible. Depression, psychosis, inflammation that's caused by that is something we know how to treat. But again, the Prozacs and the antipsychotics and things like that do not work the vast majority of time. And I don't think you'll find another psychiatrist that would disagree with that statement. But yet they practice as if they're panaceas.
Well, because if all you have is a hammer, everything starts to look like a nail, and people are not educated to this stuff. And by the way, you explain it better than most of the stuff that I've seen. I researched this stuff a couple years ago, looking at the role of niacin because our friend Khalid said, well, you got to look at this stuff on niacin. It helps people with depression, with schizophrenia, all kinds of things. And I watched a number of videos. I'm not sure the guy used the word inflammation once. Okay.
Right.
Now, it occurred to me, and based on, taking niacin myself, that it liberated a lot of energy. I felt better after I took it. I didn't know why. I just, I said, oh, I'll try it. A smart person told me to try it. I'm going to try it. And it really did help me tremendously. The question, though, is you're explaining it to people in language that they can understand. This is really an incredibly brilliant idea. It's an incredibly brilliant approach because there's no danger in this.
Well, and I
don't. If there is, I don't see it.
What you identify as brilliant, I see as just questioning why. I think the simplest difference that I could explain, and I thought about this for years, about what makes me different from other psychiatrists coming from an engineering background versus a medicine, primary biochemistry, or whatever background is, engineers have to know why. That's a question that drives us. That's a question that drives science, quite frankly. But one thing that I've noticed is doctors don't ask why. They're over, I don't want to say overqualified. They're highly qualified technicians.
They're indoctrinated. They don't have to ask why.
Oh, I like indoctrinated. It's still, there's still
word, isn't that the word doctor, where doctor comes from? I don't know.
I don't know what doctor does. Well, physician means teacher. And I think teachers, it's very hard to teach something if you don't understand it, if you don't know the why. And to me, it's very simple. I mean, we could talk about niacin. My Western training taught me that niacin is as good for the cardiovascular system as, let's say, you know, the statins. All right. Well, why don't we use more of it? I mean, this is Western medicine that's actually finally caught up to this. And again, I'm in the front row going, why? Well, the reason why is it decreases inflammation in the cardiovascular system. We know that the chronic inflammation, the hardening of the arteries, comes from things like smoking, which creates a pro-inflammatory state, diabetes, which certainly creates a pro-inflammatory state, cholesterol, your diet, what you are, what we eat. And niacin kind of, you could think of reversing that. The only studies ever shown on any statin to reverse squat was Crestor, and it was questionable and certainly modest, but it was not even as good as the studies on niacin. Now, in mental health, we use niacin to help with psychosis. Matter of fact, one of our case studies we were going to talk about today, I have the young man on niacin as well as IV vitamin C, and it's certainly an augmentation and strategy to, you know, other medications. As a matter of fact, that we were talking about IL-6 a little bit ago, patients who don't respond to SSRIs, when they go back and look at why didn't this person not respond? It's because they had higher levels of the IL-6 and C-reactive protein and other pro-inflammatory markers. So it's actually used as a predictor of response of SSRIs. So even if you said SSRIs would be effective 30% of the time, looking at the concurrent inflammatory mechanisms increases that response rate to even classic treatments like SSRIs. Same thing with psychosis. The people who don't respond to antipsychotics are found to have a higher level of IL-6, INF alpha, some of these other things we talked about last week. And that's shocking. It should at minimum be a concurrent strategy to the way that it's practiced. I like approaching the whole thing differently because the why is, this isn't working. Why are we doing this? Why are we doing the same thing and expecting different results? And other things.
Well, that's a pretty big question. Why are we doing this? I think that maybe you said it. I can't remember. Someone said it. Well, probably even before you or I. Anything new is a threat, and after a while, you know, it starts to get accepted, and then it becomes, you know, dogma. This is one of those things that I said it before. I don't know, elegant simplicity. I don't know if those were the words, but that's what I see. And to me, elegant simplicity is absolute brilliance.
Well, and you can think about approaching these people in an alternative way or a different way. You can think about thinking about the more integrative health to support more allopathic approaches. But if you rewind the tape, you can actually link to the development of schizophrenia. Look, why are we seeing more and more autism? Why are we seeing more and more schizophrenia? We've been talking about this for decades. These rates keep going up, 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 up. Why? That's very troubling. And it's worse that no one asks why. And there's plenty of studies out there. They just don't make it into the practice. They haven't made it from the bench to the bedside, so to speak. So we know during fetal development, it's a crucial time. The brain is literally doing its most rapid formation of this complex 3-pound neural net. And it's a crucial time to screw it up. We can screw up our brains at any point. But if mom gets infected with a herpes simplex virus, which could, be as simple as a cold sore, that because your immune system's weaker when you're pregnant, maybe you're more likely to get cold sores. If herpes ends up being exposed to the fetus in utero, cytomegalovirus is a very common virus most people have had. Certainly if you get influenza, if you got a cat, watch out for toxoplasmosis, gondii, babesiosis. So a lot of viral bacterial infections promote inflammation. They cause an infection. They promote maternal inflammatory markers. Guess what? It's associated. There is a definite correlation. Does not imply or implies causality. It does not prove causality, but there's certainly a correlation that these are independent risk factors for the development of schizophrenia later in life. That's pretty amazing discovery to me.
Well, and if you look at, I forget what they call it, but it's in the diagnostic manual. I'm blanking on it. It's when you have one psychosis and you never go back.
A brief psychotic disorder,
psychotic event or episode or something. Because there are people who have one psychotic event, they never have it again. The question would be why. I remember working inpatient psych and asking that question. I didn't have the elegant answer that you have. Why is it that some people, one shot never happens again? Some people, one shot, they never come back. And some people are going back and forth over time. And I was used to say to myself, well, it must be psychological stress. It must be some kind of stress. And maybe stress will increase inflammation. There's probably studies for that. But I think if we think that, we're putting the cart in front of the horse here. With the kinds of things that we're looking at, the depth of the symptomatology that we face. I tell to patients plenty of times, I can't talk you out of this. We got to do something more. Now, I'm old enough to be around when Prozac was fluoxetine.
I think it's still called that, but
yeah, probably. But this is before it was Prozac, and I was on one of the sites back in the day that was testing it. And one of the brainiacs in our group asked the question I should have asked. Usually I ask the impossible question. He says, how do we know that whether this is a double-blind study? Maybe the patients know what they're taking. The psychiatrist running the study said, of course they don't know. It's a double-blind study. We don't know, they don't know. He said, do you mind if I ask? Turned out they all knew. They were breaking the pill in half and tasting it. Every single patient did that.
Okay. That throws your study completely out the window.
Yeah, no kidding. The bottom, we tried to publish that, by the way. Nobody would publish that, which I thought was pretty funny at the time. Not so funny now. Maybe it had nothing to do with anything. Maybe it was all about inflammation.
You're talking about one study. I mean, the cytokines and pro-inflammatory markers. This is something that's been replicated so many times. As a matter of fact, a meta-analysis is literally an aggregate of data from multiple studies, for those who don't know. So there's a meta-analysis. It included 7 conclusive individual studies. It pooled the data. It has much more power and still statistical validity above even a 95% confidence interval from each of the 7. And you know what they found? Taking an NSAID like ibuprofen as a sole treatment as compared to an antidepressant indicates that they're more effective than placebo in treating depression. Why? Well, how do you not see this? I know you see it, but how do we not see this? How do doctors not see this? How do patients not trust their own wisdom in their own body?
Well, they're talking about indoctrination. They're trained not to trust themselves. I mean, you're always looking for a pundit or an expert of some kind. I just think that in the end, what will win the day is people are sick of feeling bad, and they want to feel better, and that's sort of the bottom line. That I was called a couple of weeks ago, a patient called me a unicorn. I said, I think that's a compliment, isn't it? And she said, yeah, there's nobody quite like you. You dive in at the deep end. There's nobody quite like you either, because this stuff will actually get people healthy, not just reduce symptoms.
I don't think I'm that rare. As a matter of fact, what I'm encouraged that I mean, Florida's a weird state, I'll give you that. But I'm encouraged at the explosion of research. Like from 2005 until 2009, there were over 200 scientific papers that were published on depression and inflammation. And in the last 5 years, that number's gone up to 1,000.
I wonder, I believe you. I'm not disputing it, but I wonder if we called every psychiatrist in the phone book and say, I'm depressed, I'm looking for a vitamin C IV treatment to my depression, how many would say, what the hell is the matter with you? That doesn't treat depression.
Well, that's the bench to bedside. So we're seeing, that's why I think in the next 10, 20 years, we're going to see a pretty marked change in the clinical practice, because the bench is clearly finding this link.
Well, but I mean, we're going to see it because people are going to demand it. They're not getting well the other way. And with the stress levels being so high, and they don't look like they're going to be abating anytime soon.
You know what we need to do? We need to do a commercial, like a drug company commercial. Maybe you should ask your doctor about vitamin C.
Hi, I'm not a doctor, but I play one on TV. You got to take your glasses off at that point.
Ask your doctor about, I don't know how to pronounce this name.
Ask your doctor about
What?
It may cause rectal itching.
Well, and the other thing, I'll bet you that most doctors, you can't drink enough orange juice to get that amount of inflammation. Wait, no, we can do it IV. What, you're giving them orange juice IVs? No.
And I use relatively low doses of it too. There's Linus Pauling, I think we talked on the show, was studying the role of vitamin C and interfering.
One of my mother's heroes,
Linus oncogenesis, treating cancer, the development of cancer. And he was talking about 50, 75 grams, which is a whole lot of orange juice.
Well, yeah, but I mean, so what dose are you giving people? Because I mean, maybe I should investigate this next time I go into your infusion room.
6, 12 and a half, 25, 50. I don't go over 50 grams unless we check a blood, a lab work, something called G6PD, glucose 6-phosphate dehydrogenase. Wow, look at me, I remembered something.
Pretty cool. Now, one of the things that went on for me, and maybe for other people, when the whole coronavirus thing started, my response was, let's see what I can do to, I know it was a while ago, wasn't it? What can I do to improve my immune system? So I regularly will take 10 to 15 grams of vitamin C a day, even when I don't get the infusion. And the infusion is great because you don't get a tummy ache.
Yeah, it causes less wind.
Right. I'm a believer. People out there, I go into the infusion room and have Mark give me that vitamin C thing. If I feel just a little bit of a sniffle coming on, it knocks it right out. So yeah, I mean, I'll be your testimonial, Mark. This is good stuff.
Could you put it on our website?
Absolutely, if you like. Isn't it there already? Hey, I like vitamin Infusen. People, it's great stuff. And Mark and I like to joke, but I don't like joking about this because this heals people at a level that is, I'm going to use it, that is clean.
Well, and we were just talking about vitamin C as sort of an anti-inflammatory. There's a whole lot of other
I know you use other stuff in
things that we use, but just talking about vitamin C, in addition to being kind of an anti-inflammatory, it's very strong of an antioxidant. Yeah. So a lot of people have a lot of free radicals for a variety of reasons. And it's just sort of like a blood mop. It really can very quickly take out crummy stuff at an astonishing rate. We had somebody that had a migraine going on weeks, months, and within 5 minutes, boom, migraine's gone. So that's proof that the migraine is inflammatory mediated. Now you could say, a neurologist might say, well, no, that's Sherlock. The migraine is primarily it's a vascular event. You get too much blood to your brain. And then secondarily, you get this inflammatory response. So you can treat a migraine either by mitigating the blood flow problem or the inflammatory problem, or the best approach is both. So if you use something that would change the blood flow to your brain, for some people, it's a hot shower on the scalp diverts the blood from the inside carotids more external, and that takes a little less pressure out of the brain. Desensitizing it, the way we measure neuron brain function has a lot to do with oxygen consumption, glucose metabolism. And when you close your eyes and you destimulate the brain's requirement for food and thus blood, which transports it, goes down. So even if you don't take a drug like ergotamine or some of the primary, like sumatriptan stuff that is classically used for the treatment of migraine, if you do anything to mitigate blood flow and an anti-inflammatory, yeah, you could take a pharmaceutical plus naproxen or something like that. Or you could do other things to change, like caffeine, for instance, it dilates blood vessels in the rest of the body, which pulls blood, shunts it from the brain. So that's why caffeine is included in a lot of migraine treatments. And then add an anti-inflammatory in there with it. A lot of people do great with caffeine and aspirin, or caffeine and ibuprofen.
I like caffeine. Hey, listen, what occurs to me as we're talking is that alt-psych is becoming a lot more than psych. And that what you're really talking about, and I think we made this point last time, is there's not a dichotomy between physical health and mental health. There's just health. And health in my world is a robust experience of life. It isn't just symptom reduction. And this approach has far more likelihood, because I'm going to get bold here, there's no side effects, or very, very little ones. So that you're embracing life, not just living defensively. I'm going to take this thing and it's going to block my symptom. We're talking about big life now, I think. And to me, that's a very important distinction. The kind of medicine that you do, the kind that I ask my people to do, is about big life energy. If I tell a patient, I want you to imagine you go to the beach and you're going to go over the ocean and you're going to grab some of the water for yourself. You say, well, how big a receptacle did you take? Was it a little cup? Was it a pail? Was it a swimming pool? Was it an ocean liner? Did you take another planet, to get the water? How much life do you want, people? And this approach, to me, makes so much sense from the point of view of how much life do you want? Because our bodies are designed to live expansively.
And the wisdom of our bodies and the way it works does not mirror modern health whatsoever. I mean, we kind of talked before about, let's say inflammation triggering something in the brain and the behavior. But like you said, there is really no health without mental health, physical health. It's only health. It's all connected. And patients have told me time and time again, and we've it's like learned helplessness, like the frog in the pot. We realize, if I go to my endocrinologist, they're going to tell me one thing. And if I go to my primary care, they're going to tell me another. And I know they're never going to talk to each other because, well, why would they? That's completely ridiculous. That kind of really shapes me in a way that it's hard for me to express, because
does it inflame you?
It's like having an auto mechanic that really doesn't know how to work on your car, but maybe he knows a guy that's really good at lug nuts, and maybe someone who's really good at changing fuel pumps. And then something else breaks that might be connected to one or more thing, and it will never get caught. It will be missed every time. So,
Right.
you know, we're not really into health promotion, or, you know, it used to be your primary care was sort of the leader of your healthcare team. Now it has to be you. So unfortunately, that requires a little bit of education, self-education, trust in your analysis of your own body. You can tell people, hey, you should diet and exercise and cut out the booze and get more sleep. Doctors quit doing that because no one listens. And I don't know that I would listen either unless I knew why it was important. You know, sleep is critical. For me, just to not mention it, because I think people aren't going to listen, is I consider malpractice. It's just poor care. Matter of fact, people who sleep too much sometimes have more autoimmune problems, because your immune system's most active when you're asleep. And the longer you sleep, the longer your immune system can be kicked up. That's why people usually fall ill at night, you know, in the middle of the night with sweats.
I have a question for you on this. I'm looking at our notes and I see inflammation.
Was I supposed to look at this?
Well, no, you don't have to look at it. You know the stuff already, but I have to look at it because I don't know it. Inflammation and autoimmunity. How are they related? I mean, is it the same thing?
So that's a super sexy area of research. I almost did an MD PhD in school because I recognized I was not like my cohorts, my compatriots in the MD school. But it's very interesting. There's a lot of different mechanisms. It's a brilliant and complicated question, but the simple answer is something goes amiss in the body, whether that's an inflammation or an infection, and the body responds to it. And in the process, either it throws the baby out with the bathwater and starts attacking the body itself. And you get these autoimmune illnesses, everything from rheumatoid arthritis to diabetes, to MS. Or one of the theories is that the virus genome may have portions that our immune system recognizes, which inadvertently causes collateral damage to the other cells in the body, which have a similar kind of mirror marker or sequence of DNA that gets recognized by the immune system, the surveillance. And then therefore it's harder to convince the immune system, whoa, that wasn't an enemy. The immune system really is designed to decide if something's an enemy, a threat, and either attack and kill until it's gone, or till it clearly has the upper hand. And then every time that cold sore or whatever breaks out, shingles, why does shingles come back? It shouldn't. If you had chicken pox, you should not get shingles. Why does the immune system forget and let chicken pox back out of the bag? Why does people with a mercury burden, why did they get Epstein-Barr mononucleosis, which they had in high school or college, the kissing disease? Why all of a sudden does it reactivate? It should not do that. And this is a virus 99% of us have. And it pops out sometimes in your 50s and 60s. That's a sign that the immune system is losing a battle. It's not dumb. I think it's smarter than it's had millions of years to work on this. We've had a couple hundred to consider, pat ourselves on the backs and consider ourselves masters of the universe. I think we're like a blindfolded chimpanzee with a pencil in his mouth. We probably should be let nowhere near us, because Mother Nature most of the time straightens this out. The problem is, like we talked about with Zach Bush, we're introducing all this crap since the Industrial Revolution, all these antigens, all of these toxins. There's a whole new field called toxicokinetics. It's how the crap we put in our environment is wrecking us. It's a new field, because the environment used to nourish us. It used to heal us. It used to support us.
So if a patient comes in, with depression or psychosis or other kinds of psych problems, how do you make the decision as to where you go? Do you give them medication, or do you give them, some kind of approach that would reduce inflammation, or do you do both as a general approach to treatment.
What is this, Joe Rogan? Why are you asking me the tough questions?
That's it. That's a question. I want people to know that they can come to you and they get better.
It's a good question. It depends on what I think is best. It depends.
But here's the thing.
On,
before you start,
yeah.
I tell my people, listen to what he says.
Well, I had someone yesterday that, quite frankly, had a Prozac deficiency. And 30% of the people respond to that medication. Now, is it because they all have Prozac deficiencies? Probably not. Is it because of placebo, which is right around 30%? Yeah, we probably shouldn't ignore that. But Prozac has some utility. I just think it's a minor tool in a much larger picture. So I always start with a history. I start with what they've tried and failed. I look at family. We look at genetics, we look at inflammatory, labs, markers, blood, urine, hair.
Yeah, I think that's where I was going. There are markers in the blood or the hair analysis that'll give you the sense that
sure, like the IL-6, the C-reactive protein, BDNF. We touched on a little bit last week as well, and I don't want to bore people with it, but you look for signs of inflammation. Sometimes I can look at people and tell they're inflamed. They got big, they look like this. They got big puffy things under their eyes. They got rashes on their face. Maybe they've got seborrheic dermatitis on their scalp or in their eyebrows.
Yes.
The hands, the eyes. There's a whole field of iridology. People that literally study the iris as like tree rings kind of thing, a history of what the insults in the body has been throughout the course of its life. Smokers might get clubbing of their fingernails from a chronic kind of anoxic state, lower, not getting as like they're living in Denver or something because they're smoking. People with heavy metal, sometimes like you can get purple around their nail beds, certainly gums and stuff. If it's coming from amalgams, then they're reacting to that, which not everybody does. But again, some people smoke until they're 100. Do you want to play that?
Interesting is, people are willing to wait 2 months for Prozac to kick in, or a month or 2 months. But if you give them an IV vitamin C, well, why aren't I better? I mean, they expect that to work in a day.
And it usually does.
Sometimes it does, yeah.
That's the irony. I mean, you were talking about, like, we have someone in here right now who's just got a tickle in their throat. And, I've done IVC in the past. I don't get sick anymore just because I take,
You've given it to me on the I feel a little weird.
You can actually feel it tingling, like attacking the infection in your throat. It's very
really
bizarre
amazing,
feeling.
yes.
And by the end of the night, it's pretty much gone. You wake up the next day feeling great. So it does work very quickly. I think for psychosis, matter of fact, one of the cases we were going to talk about, the other case turned out didn't work out. Smoking a lot of meth, but the case of I don't think vitamin C is that good. It can't overpower meth yet.
Well, if he stops using the meth, I think we'll be in good shape.
Yeah, well, so sometimes I tell people to stop smoking meth, remove the offending agent. Very pro-inflammatory, it turns out, meth. Not to mention making you cuckoo choo. But the other case, the schizophrenia, I usually say, let's try weekly, for a month. That's 4 infusions, once a week for an hour. And I've never had a case to date that didn't respond to it.
The thing about, I used to work in inpatient psych for several years. Until the clozapine class of drugs, I don't know if that's the right nomenclature, but you could give somebody phenothiazines and the crazy behavior would stop, but the odd interpersonal stuff would remain. Does your treatment resolve some of that odd interpersonal stuff, or does that remain?
That's exactly what's happening
case by case
with this kid this week is, yes, we removed the positive symptoms, what they call positive symptoms, like the hallucinations or delusions. But the negative symptoms, the blunting of the affect, and they tend not to respond as well. And if anything, the drugs actually make that a little bit worse because they can cause
I've seen that.
Parkinsonism and all that Thorazine shuffle. And there is probably a pro-inflammatory consequence to these D2 these antipsychotics like clozapine, although that's a very freaky one. No one's probably heard of around here. But they do get better. The interpersonal communication goes up. Matter of fact, that's the exact report that I got from his mom. That's
fantastic.
You know, he didn't say that he felt all that much difference, but you know, Lobel and difference is part of the psychotic stuff. Sometimes a patient is not always the most objective at reporting their inner state. Whereas, much like I ask my wife how I'm feeling when I really want to know what's going on, mom's with him 24/7. It's her son. She knows him better than anyone, and says, you know, he had a great week. It's been a long time since he had a great week. He's interacting more. So yeah, it does help those negative symptoms, which makes you think about inflammation.
For me, that you and I would be together, because we tend to be the last resort after people have not been able to do well on all kinds of conventional treatments. And you know, when clozapine came, and I think it was called Clozaril then, there was a brochure and it said, "A beacon of hope for schizophrenic patients and their psychiatrists." And I said to the psychiatrist I was working with, then, "Hey, Bob, I think you should take this. It'll help you out." Actually, this stuff, doing this anti-inflammatory stuff, and I don't mean the pharmaceutical kind, I mean, you know, and I don't know what else you use besides vitamin C or niacin. Maybe that's a good question. What else do you use?
Other drugs. You can use drugs like NSAIDs, like ibuprofens or Toradol's, or you know, aspirins or things like that. Again, if you have a virus, the common virus that everyone's terrified of right now going around, which we know has more of a clotting penchant in most, if not all of the people, aspirin might be a better choice if you don't have access to vitamin C, whereas vitamin C itself is antiviral. That's been demonstrated. Matter of fact, the Chinese released a big study in January 2020, a study. That was the month that it supposedly came out. And they were talking about the clinical course, not only in prevention, but the treatment. What were we doing? We were flipping people on their stomachs going, oh.
Yeah, it's crazy. And I was going to be like the last question I asked as we get down near the end of the hour. Are you running into any flack for doing things differently? Because a lot of, you know, in that virus that we're not talking about, anybody who like hiccups differently gets banned. You run into any trouble with this?
No, I found people generally don't listen to psychiatrists, so I'm safe.
Well, listen, people, you listen to Dr. Sylvester because he knows some pretty cool stuff.
Well, I just want to help. I want to help people, and
this stuff helps. And you don't have to give a big list. You know, those commercials on TV drive me crazy. Take rubber bomb, only good in toilet bowl or bathtub, and be aware of suicidal impulses. You're going to gain weight. You're going to be throwing up. You know, and as all that stuff will probably make me depressed.
The advertising itself, I like, you know, when I can't sleep, I like watching obscure YouTube videos of what foreigners think are foreign about American culture. And one thing that you'll hear in almost every country when people visit the United States, or that, you know, they sample our culture, is it absolutely shocks them that we have drugs that are advertised on TV. It's very, very hard for them to accept that. It's very peculiar. They kind of look around like, is this legal? Like, how?
Yeah, the only other country I think
how is this normal
is New Zealand, in the whole world. It's not done anywhere, but I think it's here in New Zealand. You know, if you're selling crazy, we're all stocked up. Thank you very much, as Jack Nicholson once said.
So we're going to save up and try to get a commercial. Maybe you should talk to your doctor about vitamin C.
Go Bolts.
Oh yeah, good luck tonight. We're all counting on you.
I'll bring him home.
Well, last thing we got to touch on is, don't forget about the power and the innate wisdom of your body and your intuition. You know, diet, exercise, hydration, sleep, your stress. You know, all of this has an effect on your overall health and well-being. thinking about your purpose, the existential issues, spirituality, yoga, Tai Chi, any of these practices which really help heal your body and return it to a more balanced, centered state is not only good for your immediate short-term health, it quite honestly can prevent premature death, serious chronic illnesses like cancer or diabetes. So don't wait around for your doctor to tell you things like that. And hopefully we've explained the why today.
Well, I'm reminded of a story, probably a good place to wrap up. When I was a teenager, we went on a big bike trip out on the island in New York, and we camped out on the beach. And my best friend's complaining about the bugs and the sand, and my father, in a moment of extreme wisdom, says, "John, look, you got the ocean, you got the sky, you got the earth. Your parents love you. Shut up and go to sleep."
Yeah.
Not a bad philosophy.
I like that. Can we put that on a bumper sticker?
It's a little long, but maybe on a hat.
I can put it on a prescription pad.
I like that.
I have written.
You could also put on. You could also put on the pad.
Be well.
Be well. Woohoo!
Oh, that was slicker than an eel in a bucket. Okay, I can't say that on TV.
Hey, thanks for bringing this topic up, Mark. I love it. I think this is the future of psychiatry, and it's the future that's happening right now.
All right, let's get to work.
All right.
Until next week.
See you, people.
Peace on earth. Peace
Go
on
Bolts.
you.
Go Bolts.
And that too.